Welcome back, friends. So today we are joined by Dr. Jen Gwilym, and she's going to talk about CGM skin reactions.
Hi, Sarah.
How are you?
Great, how are you?
Good, good.
Thank you for having me today.
We appreciate you being here.
You're very welcome.
So we have a few questions for you about some CGM reactions, the skin reactions that people may have. So the first question we have is maybe what type of skin reactions might someone see from a CGM?
Thank you very much for that question. So we're actually starting to see quite a few skin reactions, especially with the increased use of CGMs.
Okay.
So probably the first and most common is tissue damage and some scarring.
Okay.
So, this kind of is the body's own immune system taking over. Could be from a little bit of skin damage from insertion, but really the scarring is just how people heal after they've actually introduced something into their body. Not a lot we can do for that. Some of the things that we can do to try to prevent that, though, is rotating that CGM placement. And we really recommend every 10 to 14 days. So within 2 weeks, you should really be moving that site to someplace else so that you're not getting overuse there for increased scarring.
Okay, that's a really good idea. Anything else? What else can happen at that site? So scarring.
So we're also seeing some hypersensitivity reactions.
Okay.
So basically that's an allergic reaction. So a couple things that can be causing this. First of all, it could be the body's own immune response taking over. This is a foreign substance being inserted into the body. The body just may not be able to tolerate this.
Okay.
So what I tell people usually to do is try moving that CGM to another area and see if you have the same reaction. If you do, it's possible you may not be able to use that CGM and need another type of CGM, or you may not be able to use that CGM at all.
Okay.
So to treat that, I usually tell people what that's going to look like is that's going to look red. A lot of times because it's allergic, it's going to be itchy.
Okay.
Maybe a little painful, and sometimes people describe it as stinging. A lot of times removing it from that area is helpful, and also topical over-the-counter steroids may also help. So you could try some hydrocortisone 1% that you can buy, or even an allergy pill such as Zyrtec, Claritin, Allegra. And if these symptoms persist, you should definitely see your primary care physician.
Okay, interesting. Very good. Any other skin reactions?
The other one that we're seeing a little bit of that's much less common is lipodystrophy.
Okay.
And this can either be excess of tissue or decrease of tissue. So you may have a mounded area where you've used that, or you actually may have a divoted area. And again, this is kind of just your body system and how it heals. Things that you can do to help with this, again, would be to definitely rotate those CGMs and not keep using the same place over and over again.
All right. Is that the same thing we would see with insulin? Is that similar to that?
Absolutely.
Okay.
People get that favorite spot where they like to stick themselves and they use it over and over again, and this is one of the negative side effects that we see there.
Okay,
Yeah.
interesting. That's
Yeah.
a good one. That's good. Anything else how they would be treated? We talked about hydrocortisone.
Yeah.
Any other suggestions? And then rotating sites.
Yeah, rotating
Okay.
the sites. And then the other fourth one that we see that's also becoming a little more common that we see in the office is infection.
Okay.
So, people will develop red, warm area there underneath. Sometimes you can actually see drainage coming from the opening, and that can actually be pussy sometimes.
Okay.
We worry about this, and people should definitely be seen by their primary care physician because they may need antibiotics for this. People can get very sick from infections.
Okay, that's good to know. Anything we can do to prevent it?
Yeah, some of the things that you can do is definitely, the first thing I would say is wash your hands. So wash your hands before you even open that CGM.
Okay.
Looking at your skin and cleaning it. So making sure you've washed it with soap and water. Clean that area with alcohol.
Okay.
Make sure that alcohol is dry before you make any insertions.
Okay.
Also being careful applying your lotions, your sunscreen, any type of tanning oils. You definitely don't want to inject those in.
Okay.
Making sure that you don't have any skin lesions or skin tear there.
Okay.
As we age, especially, we get skin tear. So making sure you put it around that area. And also, again, the big thing is rotating those CGMs every 10 to 14 days.
Fantastic. That's wonderful. Thank you so much for that information.
You're welcome. Thank you for having me today.
I hope you have a good rest of your day.
Thank you. You too.
Thank you, friends. Until next time.